Good morning, everyone. I'm Carla Macias, host of Best Docs Network featuring Forest Park Medical Center, Austin. Our show is dedicated to connecting people to the right doctor and hospital. We'll be featuring doctor-patient stories, as well as take a look into the facilities, amenities, and philosophies of Forest Park Medical Center. Now, what a better way of starting today's show than by learning the culture of Forest Park from the CEO himself, John O'Neal.
Austin is very fortunate to have Forest Park come to this area. Forest Park is unique in that it's owned and operated by the physicians. So we're very fortunate to have a group of almost 100 physicians from the Austin area. I think they average about 15 years experience in Austin, every one of these physicians. So they know Austin, they know the people of Austin, and they know what Austin needs when it comes to healthcare. I think patients benefit greatly from a physician-owned hospital for many aspects. One is that who knows better than your physician what you need when you're in the hospital. And again, many physicians don't have that control or that voice in a typical hospital setting. But in this setting, they do have control, they do have a voice, and they will do what's best for their patients. I think it's the difference between owning a car and renting a car. When you're an owner, it's your place, and you want to make it special. You want to make it the best place for your patients to get care. And so I think that's really what makes it different. Our goal is to be the very best hospital in the community. Obviously, physicians know best what's good for their patients, and they wouldn't be so interested in this hospital and creating this hospital if there were a good alternative for them currently. So they're very excited. I'm very excited about working with them. It's going to be a very collaborative approach. I think there's a lot of uncertainty, obviously, in the healthcare industry right now and going forward. No one really knows what's going to happen. But to be successful, there has to be close collaboration between the physicians and the hospital. And what closer model can you have than having the physicians own the hospital and really control the hospital? So I think it's a successful model for the future and one that will greatly benefit this community. My example is the hotel industry. You could tell there's a difference between a 5-star hotel and a 2-star hotel. The people are happy to be there. People have just loved getting care there. You go to a 5-star hotel once and you want to go back to that hotel. That's the environment we want to create. You combine that with state-of-the-art equipment, state-of-the-art care, and that's going to be Forest Park Medical Center.
Male incontinence is a problem that we see typically after prostate surgery or pelvic surgery. After a radical prostatectomy, the rates of bothersome incontinence in the male are about 5 to 15%, depending on their particular situation.
I'm a prostate cancer survivor, and I had a radical prostatectomy. And basically, the key side effects of that is either incontinence and impotence, and I basically had both. So the initial issue was, after about 2 years of physical therapy, I wasn't able to rehab that area of my pelvic floor and was still, as Dr. Bryan Kansas would say, severely incontinent, and began to look at some options.
Bob's a gentleman that I met, actually I rounded on him after he had his radical prostatectomy here in Austin. He went home and he did pretty well from a prostate cancer perspective, but he had pretty significant erectile dysfunction and incontinence. I had him do pad weight tests, which I do with all my patients to see exactly how much they're leaking, and he did end up in the severe category. I like to figure out if patients have mild, moderate, or severe incontinence after a radical prostatectomy, because that way I can help choose what is right for them in their treatment. He was in the severe category. I ended up actually placing an inflatable penile prosthesis and an artificial urinary sphincter in him, and that's about 5 years ago, and he subsequently has done very, very well.
So the recovery process is about 6 weeks. Swelling has to go down, healing has to take place, and those kind of things. But it wasn't inordinately. It's nothing that ice and Motrin can't take care of, and it wasn't that difficult. And basically, it's easy, very functional, easy to use, as long as you've got good dexterity in your hands, and no one knows where it is. The reservoir's up in your pubic area. They can't see it. The little ball for the fluid is down there. You just push a little button and you urinate, and it automatically closes itself after about 60 seconds. So it's very easy to live with. I'm glad to be a patient of Dr. Kansas. I like him, and he's a good guy, and I'm just pleased to be able to say that publicly.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. Dried plums or prunes are packed with polyphenols, a plant chemical that has been shown to boost bone density by stimulating your bone building cells.
The vision we had for Forest Park Medical Center in Austin was pretty simple. I mean, we wanted to dig down and really understand what the community wanted. We wanted to talk to the physicians. We wanted to talk to the people that live there. We talked to the mayor and all the city officials, and we really wanted to understand Austin.
Forest Park Austin really represented a unique opportunity for us. Austin's a community that is a little bit more laid back. It's a community that gave us a lot more creative and the ability to be more liberal with the design, do things that were a little bit funkier that maybe wouldn't fit in a more conservative setting like South Lake or Fort Worth.
The art program is something that we're paying a lot of attention to. Some of the finishes are unique to Austin. We're using a lot of the local stones in the facility.
And just a mix of building materials together to come up with a unique project and something that you just don't see every day.
Well, the layout of Forest Park Medical Center is consistent across most of our hospitals. What we'd like to characterize is we have a chassis that works very, very well. And that's not to say that they're the exact same from hospital to hospital, but the fundamentals are the same.
From the time that either a patient or a doctor arrives on site, we want it to be very intuitive. Where do I turn in? Which building is mine? The layout of our lobby, the layout of our doors. If you're a physician, a staff member, or a patient, it's very intentional so that you can get through easily and not have a lot of stresses and anxiety just with reaching your final destination.
We're paying a lot of attention to green space, taking some of the outdoors, indoors, and some of the indoors, outdoors. We wanted to have great transition space, a lot of the local planting, and we have sculpture, so you feel as though it's one area.
Forest Park Austin is going to have a total of 40 patient rooms. They're mixed between private patient rooms and then VIP patient rooms. All of the rooms will be fit out like a very nice hotel. We pay attention to every detail. The quality of the materials used, the quality of the linens that go on the bed, quality of the furniture selected.
We're really paying attention to the patient experience. We have the best surgeons, we have the best nurses, and we have the best administrators. Austin is no different.
Forest Park Medical Center is a physician-owned hospital that is committed to providing personalized patient care in an environment that employs the most current advances in healthcare. Now up next, we're going to take a look at what some Austin physicians are looking forward to at Forest Park Medical Center.
So why did I join Forest Park? Well, this is an opportunity for me to be a part of the best hospital that's going to be in Austin. This is going to be a conglomeration of the best physicians and the best surgeons in the entire city, all coming together to make the most efficient, cost-effective place for functioning in the entire city of Austin. I'm excited to be a part of it. I'm equally or more excited about this for all of the patients that are going to have the best medical experience that they've ever had in this city.
Austin is pretty much dominated by the very large hospitals that pretty much serve the community, not by smaller hospitals that are private. Well, I think that there's a lot of individuals who are private individuals who may need surgery that could really benefit from a physician-owned, physician-run hospital that's going to cater to good service, good outcomes, good surgery. So to be part of that as an investor, I was excited about that, and to be involved with the doctors who will be doing surgery there. And as a primary care physician, I'll be involved in my referrals to the doctors who are doing surgery so that there is a continuity of care between the surgeons and the primary care doctors. and knowing that the patient is going to get very good medical care.
We're very excited about Forest Park Medical Center coming to our area because we understand that there's a very high caliber physician that practices at these centers. They've had a lot of success in the Dallas-Fort Worth area. I think we're fortunate to have a facility of that level here in Austin Round Rock.
A physician-owned hospital means that we can give you the care that you need without having the bureaucracy. We don't have a person in charge who isn't involved in medicine, somebody who's telling us that we have to do something because it's a rule of the hospital. We can make medical decisions because that's what's best for you, not because it's the rule of the hospital. And the people that are involved in this project are just phenomenal. It's going to be an amazing project.
Sarah has a question for Dr. Snyder. Will my breast feel and look normal after reconstruction surgery?
If we use your own tissue, meaning if we use skin and fat to make a new breast, feel-wise it feels almost identical to a normal breast. There could occasionally be some small areas of hardness or firmness, but that's very uncommon. And in comparison to an implant reconstruction, which may feel fairly natural, you can still typically feel an implant within that reconstruction. And cosmetically, I think that most patients have breasts that look as good and many times better than their breast before reconstruction, or before they ever had a mastectomy. So I think that our outcomes are very good, and I think that the expectation should be that someone should have a breast that looks and feels like normal.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Before we even start the surgery on the patient, we actually review the plan. The 3D analysis that was obtained from the CAT scan allows us to see the knee in real time. And this allows us to see the orientation, the alignment, and actually the size of the implant that we'll use. So I can actually look with 3D technology to see exactly what the implant looks like, the alignment, the rotation. As we get into the surgery, I can actually make adjustments in surgery to balance the ligaments inside of the knee as well. So once we place these pins into the bone, we attach what we call arrays to the pins. And this allows us to consistently always know the position of the bones at all times. Once we register both the patient's anatomy and register the robot, then the next step is to actually begin the surgery itself. So I can slowly chisel away the bone that's necessary. When I look at the screen, the green data tells me the extra bone that I must remove. What's critical is this robot will not allow me to go outside of the plan that we've instituted in the very beginning of surgery. The surgeon is actually still doing the surgery. The robot is just allowing the surgeon to do it in a more precise manner because the robot will not let me deviate from the plan at hand. Then the next step is to trial or place the implant to see if it fits correctly. And as you can see, it's perfectly aligned, the rotation is perfect, and as a surgeon, it's very exciting to see that we can do this reproducibly, consistently, and do it successfully. This technology allows us to do surgery with the smallest incisions possible. Our patients are recovering much quicker than the traditional approaches.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
So the question often comes up, am I contagious or not? Well, part of the reason why the common cold, for instance, spreads as fast as it does is because you're actually contagious before you get symptoms. So if you're exposed today, it takes several days for that virus to replicate like mad. And once you reach a certain threshold, now you start to spread that virus out in the community. Then shortly thereafter, you develop symptoms, the runny nose, sore throat, and so forth. And at that point, you realize, uh-oh, I've got a cold. Don't come near me, I'm contagious. Well, it turns out you've already been spreading it around. So that's the reason why, you know, for the common cold or the flu or a digestive virus, why, you know, it spreads so fast is because you're contagious before you even realize it. And that also kind of ties into, you know, do I need an antibiotic or not? Most of the time you don't. Usually these things are viral. Virus particles survive on all surfaces for days, weeks, and maybe even longer. For the certain kinds of bacterial infections, so let's say strep throat, for instance, after you get about 2 days of antibiotics in you, you're no longer contagious. So that would be the threshold at which it's safe to be around small children and so forth.
BestDocsNetwork.com is your source to finding the right doctor. By clicking on Austin under the Our Doctors tab, there you can browse through all the different specialties, check out their profile pages, and watch more educational videos. Dr. Terry Chambless is an internal medicine specialist here in the Austin area. Now let's listen as Dr. Chambless discusses high cholesterol.
High cholesterol is another one of our big 4 risk factors for arterial disease. And if the cholesterol is too high, it will actually diffuse into the wall of our arteries, and that's not a good thing. You know, high cholesterol really comes from 2 places. We either eat it or we genetically make it, and a lot of people do both.
For years, I went for a yearly physical, I think starting in my 30s. At the time when my cholesterol was noticeably higher, my doctors, you know, kept saying, you know, you need to be put on some type of medication. And I just couldn't. I thought this is too young to start taking any types of medications.
And the treatment for that really needs to be centered around going after dietary factors and treatment for that, and genetic overproduction and treatment for that. And we've got great medications for both of those.
When he got my numbers after all my blood work, my physical, Dr. Chambless told me that I really needed to bring my cholesterol down. The only way would be medication. But Dr. Chambless had decided to just start me on a very low dose and just see if that would adjust. And it did for a while, but then he had to boost it. I mean, it's just, the numbers are incredible now.
Bonnie's an amazing lady. When she first came to see me, her cholesterol was high, and I really think her prior physicians were not being aggressive enough at getting her cholesterol down. She humored me, and she let me start her on medication. Her numbers have come down, and she's got a bright future ahead of her. We have a lot of data out there that show if we get our numbers low enough, especially with the LDL cholesterol, that we can keep fat from building up in the wall of the arteries, and that's what I hope for Bonnie.
Dr. Chambless really took the time and discussed things with me that no other doctor had ever done. Everything that Dr. Chambless's staff does, I feel it just couldn't be any better.
Today, Forest Park is delivering toys that our employees have collected to the Salvation Army. This is something that we participate in every year, and it's something that we do as a way to serve those in our community that we, throughout the year are serving, but this is our way just to give back during the holidays.
Today we have our shared services holiday luncheon, and it's just a fun time to get everyone together. We have a tacky sweater contest and food provided, and just a time to hang out with all your other coworkers.
Forest Park culture is geared toward a sense of community. You really feel a sense of belonging. You feel that you are a part of an important system, which it really is. And everyone exudes a sense of pride. Everyone that you see is smiling. Everyone has a very good attitude and feeling towards Forest Park. It's palpable, you feel it everywhere.
Working for an organization like Forest Park, you feel like you're serving the community every day, and there's, throughout the year, always opportunities to give back, and they really keep you plugged in and aware of those opportunities. So while, this time of the year we're certainly giving back by giving toys to the less fortunate, there's always opportunities at Forest Park to give back, and it makes it just a great place to work, and you really do feel like you are a part of something bigger.
Forest Park is very generous with their employees. They offer us a lot of holiday events, and we had a Thanksgiving event, and they also give us the time to spend with our families. They have an excellent PTO plan.
Because Forest Park is very generous with their PTO plan, it allows me as a father to spend time with my kids and my family. The people here are genuinely really nice. It struck me the first day that I started. When I would walk around, people would smile, say good morning, how are you? There's just a different feeling, a type of hospital at Forest Park.
Management specialists are experts at diagnosing the cause of pain and then treating it. Dr. Genaro Gutierrez is a pain management specialist here in the Austin area. Now let's meet the doctor.
I specialize in pain management, which is a division or a field within anesthesiology. What it is it's an approach towards treating pain and helping the patient manage their pain. Often pain is difficult to manage for a variety of reasons, so you have to take a multidisciplinary approach. I often tell all of my patients that pain is pretty difficult to cure, but it's very manageable. Patients with chronic pain will experience changes in their lives at home, lives at work, and even their relationships. I enjoy playing a role in making their lives better.
To avoid your child being poisoned, be sure to store all medicines and household products up, away, and out of sight in a cabinet out of their reach. Poison Control reported 9 out of 10 poisonings in children occur in your home. Pelvic organ prolapse is a common issue that most women will experience after bearing children. Dr. Tomas Antonini is a urogynecologist here in the Austin area. Now up next, Dr. Antonini will be discussing pelvic organ prolapse with one of his patients.
I was having difficulty urinating. It didn't want to flow evenly. It would stop and start, and I would have to reposition myself to get the urine to get my bladder to empty. When I would sit down, there felt like there was a lump there. I had difficulty sitting. Would have to shift my body so that the lump would actually go back up into the passage.
Pelvic organ prolapse is a common condition where one of the female organs are dropping through the vagina, such as a dropped bladder or a dropped rectum or a dropped uterus. It is ultimately a form of a hernia that is happening through the vagina.
I could feel the lump when I was walking or trying to sit, and it was getting larger and larger.
The most common organs to prolapse through the pelvic floor are the bladder, where we call them cystoceles, or the rectum, they are called rectoceles. And then on the top of the vagina, we can have the prolapse of the uterus, or the prolapse of the top of the vagina after the patient had had a hysterectomy before.
Dr. Antonini explained to me that many women, after having childbirth and getting older, our muscles are getting weaker, And sometimes it's also an inherited factor, which I was surprised to learn.
For non-surgical treatments, usually we can resort to pelvic floor physical therapy or the use of different devices, usually called pessaries. For the ultimate treatment, usually we resort to surgery. There are multiple different operations and techniques that can be used to surgically correct pelvic organ prolapse.
Dr. Antonini gave me treatment options: have the surgery and rectify the problem, or just go on as I was going on, which was very uncomfortable. I chose the surgery. Having this procedure done by Dr. Antonini has been absolutely wonderful. It makes me feel like a new person. I feel wonderful. I feel wonderful.
I am the director of critical care, so I have a couple of different departments that handle all of our really critically ill patients here at the hospital. When I came to Forest Park, we were just starting. It was brand new, and so I got to get in on the ground level. I got to participate in developing our new policies, our processes, and it was really rewarding. To be a nurse at Forest Park, I look for three things. I look for someone with excellent nursing skills, someone with excellent customer service skills, and someone with a great personality. Because we are a small hospital, I have small departments, and it's really important for a new employee to fit into our family. As the director of critical care, I think, honestly, the physicians don't want to have to use my departments. However, I think they find it a comfort that if they should need the emergency room or if they should need the intensive care unit, we're here, we're ready to take care of their patients, and we can take care of their patients just as well as anywhere else in the Metroplex can. When I first came to Forest Park, I was not familiar with bariatric procedures at all, and so I found it very interesting and very rewarding to learn new things. I think that unless you've worked at a hospital like Forest Park, you're gonna find that there's a lot to learn, a lot to do, and a lot of rewarding experiences to be had here.
Justin has a question for Dr. Hardeman. What are the causes of kidney failure?
I think the most common causes these days are obesity and the concurrent problems, the medical problems that generates. Weight gain increases blood pressure, increases demand on the kidneys, also makes you more prone to develop diabetes. Diabetes is one of the most common causes of kidney failure. It affects the blood flow of the kidneys, and so the combination of weight gain, high blood pressure, and diabetes is probably the most common cause of kidney failure these days.
Lodging provided by Radisson Hotel and Suites. Thank you everyone for joining us this morning on another episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. Now, if you're still curious about this hospital or you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.